Knock, knock, knock.
Come in.
I'm gonna go ahead and close this curtain to give you some privacy. Hello, my name is Joshua. I'll be your nurse today. I'm gonna perform some hand hygiene. So I'm gonna be performing a full head to toe assessment on you today, just to assess your entire bodily functions. Is that all right with you?
Yeah, that's okay.
Perfect. And I just want to ask you just a few questions. So, what is your name and date of birth?
Zoe, February 4th, 2004.
Okay, and that checks off with my chart. And just a few more. Let me go ahead and move this out of the way for you, and I'll give this back to you later.
Okay.
Um, Let me go ahead and just ask you a few more questions. Do you have any allergies?
No.
Okay. And do you know where you are right now?
Yes, the Concordia Hospital.
And do you know what year it is?
2025.
Okay, patient is alert and oriented times 4. And what brings you in today?
I'm here for a head to toe assessment.
You're here for a head to toe assessment?
Yeah.
Do you have any pain?
Yeah, my feet.
Oh, your feet. Okay.
Yeah.
And
I jammed it.
you jammed it.
Yeah.
And when did that happen?
Yesterday.
Yesterday. Okay. And on a scale from like 1 to 10, 1 being very minimal pain, 10 being the most pain, what would you rate that?
Probably like a 2.
A 2. Okay. And does anything make it better? Does anything make it worse?
Just like sleeping makes it better.
Sleeping makes it better. Okay. And well, how would you describe it? It's like dull, achy, sharp, radiating.
Dull.
Does it radiate anywhere?
No.
Okay, perfect. So is there anything that I should know before that would impair me for be able to do the rest of the exam?
No.
No? Okay. So I'm going to go ahead and raise this bed. So I'm going to go start with a pupillary exam on you first. Is that all right?
Yeah.
It's going to require me to shine a little bit of a light in your eyes. Is that okay?
Yeah.
Okay. So I want you to go ahead and look straight forward. And I'm going to go ahead and assess your pupils. Okay. And now could you look in the center of my pen? And don't follow with your eyes and not your head. Okay. So on examination, patient's eyes are perla, meaning the pupils are equal, round, and reactive to light, accommodating, and all 6 of her cardinal fields of gaze are intact. So now I want to go ahead and start from your head and move my way down to your toes. You mind if I start with your skull first?
That's okay.
Okay, perfect. So patient's skull is symmetrical and normal sized. Her hair and her scalp are free from any infection or any erythema. No lice noted. Now, eyes also, there's no swelling, no jaundice, no erythema. Do you use any contacts or glasses?
No.
And now I'm going to go ahead and look at your ears. So ears show no signs of bleeding, no signs of swelling. Do you use any hearing aids?
No.
No? Okay, I'm going to go ahead and look at your nose. That's okay? Could you just look up? Okay, so nose is clear, no polyps, no bleeding, no swelling, no trauma. Can you open your mouth so I can look at your throat? Okay, so throat shows no sign of infection, no swelling. The tongue is pink and moist, and mucous membranes are intact. Okay, now I'm gonna go ahead and assess your range of motion, your strength, and your upper extremities.
Okay.
Is that all right with you?
Yeah.
So you follow after me because you put your arms out right in front of you and then to the side. Okay, so the patient has full range of motion against gravity. And I'm going to go ahead and assess your strength. You push down on me, and push up, you squeeze. Perfect. So the patient has 5 out of 5 strength and upper extremities. Now I'm going to assess the skin. So the skin is warm to the touch. The skin trigger is brisk. And there's no flushness, no paleness. It's warm. It's consistent with her ethnicity. I'm going to check your cap refill. Is that all right?
Yeah.
So cap refill is less than 2 seconds and upper extremities, which is good. And can I go ahead and check your pulses?
Yeah.
Okay. So the temporal pulse is 2 plus equal bilaterally. Your carotid pulse, I'm going to check unilaterally. It's 2 plus equal bilaterally. Could you hands it like that? Her brachial pulse is 2 plus equal bilaterally, and her radial pulse is 2 plus equal bilaterally. And now I'm going to go ahead and move on to the respiratory portion of your exam.
Oh,
Can I go
yeah.
ahead and do that?
Yeah.
Actually, let me first take your temperature.
Yeah.
Okay, temperature is 98 degrees, which is perfect within normal range. Now I'm gonna go ahead and listen to your breath sounds. Is that all right with you?
Yeah.
Well, first on examination, patient's chest is symmetrical. There's no barrel chesting. Her respiratory rate is 16 breaths per minute. Can I go ahead and check your pulse ox?
Yeah.
Patient's pulse ox is 99% room air, which is great. And I'm gonna go ahead and lift up, listen to your breath sounds over your beneath your gown. Is that all right with you?
Mhm.
So I'm gonna listen to 6 anterior and then 8 posterior. 2, 3, 4, 5, 6. Okay, and you mind turning that way for me?
Mhm.
Okay. So patient has no signs of trauma or any pressure wounds on her back or on her back of her head. Breath sounds are normal. There's no increased work of breathing. There's no nasal flaring. There's no sternocleidomastoid use. There's no abdominal muscles. Yeah, and then do you have a cough at all?
Oh no, I don't.
Is there any phlegm associated with it?
No,
No
no,
phlegm, no
no,
cough. Okay,
no.
great. So now I'm gonna go ahead and move on to my cardiac assessment. So, do you mind if I listen to your heart sounds?
Yeah,
I'm gonna go reach underneath your gown if that's all right.
that's okay.
So I'm gonna start here: aortic, pulmonic, Erb's point, tricuspid, and bicuspid or mitral. Sorry, mitral valve. And I'm gonna listen to the apical pulse, which is at the fifth intercostal space at the midclavicular line. So that one is 70 beats per minute, which is great. It's normal. Okay, and I don't know any edema in the upper extremities, which could have been indicated for heart failure. Let me move this up for you. This gown is falling off. Perfect. I'm gonna go ahead and remove these rails, or move down these rails. So now I'm gonna work at your abdomen. I do an abdominal assessment. Is that all right with you?
Yeah, that's okay.
I'm gonna move this down and lay you flat. Is that all right?
Yes.
Okay. So move this up. If that's okay. Okay. Now, for examination, the stomach or abdomen is flat. There's no signs of any distension. Um, and I'm gonna go ahead and I'm gonna move this down as well. Do you mind if I listen to your bowel sounds?
Yeah.
I'm gonna start in the right lower quadrant and work clockwise. I've listened for a minute in each quadrant, and then if I don't hear any breath sounds, I'm gonna listen for up to 5 minutes. That's okay?
Yeah.
Okay. Okay. So bowel sounds are normal. There's no hypo or hyperreactive bowel sounds. Now I'm gonna go ahead and percuss. Is that all right?
Mhm.
I'm gonna start in the right lower quadrant. And,
Mhm.
so there's tympany heard in all 4 quadrants, and there's dullness in the right upper quadrant with the liver, which is great and expected. So now, before I palpate, do you mind if do you have any abdominal pain?
No.
No. Okay. So I'm gonna go ahead and palpate, starting in the right lower quadrant. Okay. So for palpation, there's no tenderness. There's no masses or any lumps, any enlarged organs that are noted. There's no pressure, so that's great. Now I'm gonna go ahead and palpate your bladder. Do you have to use a bathroom at all?
No.
So bladder is not distended, which is amazing. And I have some more questions about your urinary system. So when was the last time? Actually, let's go back to the abdominal assessment. When was the last time you had a bowel movement?
Yesterday.
Okay, and how was that? Can you describe that for me?
It was like brown and soft.
Brown and soft. That's normal for you.
Yeah.
Okay, and any constipation, any diarrhea?
Nope.
Okay, and when was your last time you urinated?
This morning.
This morning. And is that normal for you?
Yes, that's normal.
And was there any odor? Did you have any difficulty urinating at all?
No difficulty, no order.
No.
No.
Okay. And the bladder showed no signs of distension, which is great. Okay, and now I'm gonna move on to your lower extremities, if you don't mind.
Yes.
So, sorry. So I'm gonna go ahead and check your pulses first. If your femoral pulses, so those are your 2 plus equal bilaterally, and then you mind moving your knees up. Okay. I'm gonna assess the popliteal pulses. Those are 2 plus equal bilaterally. I'm gonna do the posterior tibial. Those are 2 plus equal bilaterally, and then the dorsalis pedis are 2 plus equal bilaterally. Um, can you move your legs down so I can examine your heels? The heels show no signs of any pressure injuries or wounds. Skin is intact. Skin is warm, consistent with your ethnicity. I'm going to check your capillary refill. Lower extremity cap refill is less than 2 seconds, which is good. And I'm going to assess your range of motion. So do you mind moving one leg up and then perfect? Okay. Perfect. Okay. So she has full range of motion against gravity, and then can I test her strength by pushing on my hands like a gas pedal and then back the other way. Patient has 5 out of 5 strength in lower extremities, which is great. And then I'm gonna put this back. I have a few last questions. So, what does your dietary intake look like?
I eat chicken, rice, veggies, and vegetables.
Okay. And how much water do you drink per day?
64 ounces a day.
Okay, perfect. And do you have any difficulty swallowing?
Nope.
No. And do you have any nausea or vomiting?
No.
No? Okay. So I'd like to recommend you to MyPlate, which is a great nutritional thing that we can give you to help you with your dietary recommendations and your nutrition. Would you be interested in something like that?
Yeah, I'll be interested.
Okay, perfect. Go ahead and think about. Oh yeah, and also, do you have any issues ambulating with any assistance? Do you use a cane or anything?
No, I don't use a cane.
Okay, so a patient is able to ambulate without any assistance, which is great. So now I'm gonna go ahead and move your bed back up and move down your gown. Okay. And moving the bed all the way down to its lowest position. That's the lowest, and then I'm going to put the side rails back up. I'm going to go ahead and hand you your collet. You use that if you need me.
Okay.
I'm going to go ahead and take my gloves off and perform hand hygiene. And then I'm going to go ahead and give this back to you. Perfect, and I think that concludes our examination. Thank you.
Thank you.